Welcome to Peanuts Corner for this month of August. I am Dr. Iris Rosenfeld from Laguna Hills, California, and of course I have Peanut here with me today. That's right, say hi everybody. Yeah, and Peanut is all decked out for August. Doesn't she look cute? Her new purple bow as well. So I'd like to welcome you to the month of August and the 10 key benefits of vitamin D, known as the sunshine hormone. And I'm going to teach you 10 benefits that you must know. First of all, is vitamin D just an ordinary vitamin? It really isn't. It's really a steroid vitamin, and it influences pretty much every human cell receptor in our body. Vitamin D is fat soluble, and it's a prohormone, and it exists as D2 from plant sources or D3, which is found in salmon, wild salmon, cod liver oil, sun-dried shiitake mushrooms, sardines, mackerel, and tuna. And there are many supplements that contain vitamin D. And my suggestion is that if you're going to purchase a vitamin D supplement, make sure it is pharmaceutical grade, as a pharmaceutical grade vitamin D supplement gets into the body where it is needed. Now, you've heard a lot about vitamin D, and the reason is because vitamin D deficiency is an epidemic worldwide today. And that mostly is because people are just not getting enough of the sun. So let's start with number one. The number one benefit of vitamin D, most important, talking about the sun, you need to get safe sun exposure without sunblock and near to solar noon as possible. The UVB rays are the portion of light that is diffused at the earlier and later parts of the day. You need to expose a large portion of your skin, and you want to wait until your skin turns that little bit of pink. So it should take about 20 to 30 minutes. That's step one. Key number two, what about tanning beds? Tanning beds may be necessary if you are using the electronic ballast instead of the magnetic ballast, because you want to avoid unnecessary exposure to EMF fields. Number three, if any of those two that I just suggested is not possible, you want to supplement with vitamin D. And the main purpose of vitamin D is for the function of calcium and phosphorus in the blood to support bone mineralization, proper nerve and muscle function, etc. Number four, vitamin D has a very diverse role in many health-related issues, especially involving inflammation. Number five, in recent years, there have been many studies that are as well on my website talking about scientists that have found profound effects that vitamin D have on the immune system as well as autoimmune conditions, and finding that vitamin D can reduce flare-ups in autoimmune conditions. Number six, vitamin D helps prevent cancer. And we find that it blocks cell differentiation and growth. And again, like I said, I have numerous published articles on vitamin D and this on my website. Number seven, it was reported that vitamin D as well helps for the immune system. It's 3 times less likely to get colds and flus if your vitamin D level is optimal. Step number 8. Vitamin D helps and has a role in women's health, including PMS and pregnancy. So if your vitamin D level is deficient when you're pregnant, there's a high likelihood that the vitamin D level will also be deficient in your infant. We want to make sure that you have normal brain function for your infant as well as yourself. Number 9, vitamin D is very helpful in lean body mass. In other words, it is successful in participating in a weight loss program. And number 10, vitamin D. We want to make sure that you do not I'm emphasizing, do not use the synthetic and highly inferior vitamin D2, which is what most doctors will give you in a prescription. So you must ask for D3. There is a study that's being done. It's called Grassroots Health. It's an organization run by Carol Baggerly, and she has shown that there appears to be approximately 8,000 IUs needed per day to achieve healthy ranges of vitamin D if your vitamin D level is low. And you're probably saying, well, what kind of vitamin D should I have my doctor order for me? We recommend, it's called 25-OH or 25-hydroxy vitamin D. So, you must make sure that you get a blood test and check your optimal ranges. Your optimal ranges can be found on my website, on this article in more detail. Did you know that by correcting your vitamin D deficiency, you are going to cut your risk of death by over 50%? So, what are you waiting for? This is Dr. Iris Rosenfeld. In the month of August, we are offering 10% off the purchase of vitamin D at our office. You may reach us at www.driris.com. Our phone number, 949-380-7215. And my website is dr.iris@earthlink.net. And I think it's time for Peanut and I to say bye-bye. Okay, so bye-bye, everybody. Say bye to Peanut. Until next time.